If cranial nerves ever felt confusing, this lesson is for you, because usually they do not feel confusing because the nerves themselves are difficult. They feel confusing because the vocabulary and the terminology comes before the logic. Somatic, visceral, afferent, efferent, special, general. And suddenly, these words are compressed into abbreviations, and the whole topic starts to feel like a wall of terms and letters. So, in this lesson, we are going to slow it down, and we will start with what each cranial nerve actually does. Okay, so one, what it does, okay. Two, we're going to talk about the components. Then we will group them in a way that your brain can follow. So, sensory, motor, or mixed. Then we will decode the language. So the third thing, we'll talk about what type of fibers. So we are going to decode the languages around the types of fibers that each cranial nerve entails. Then, the fourth thing, where is the nucleus? Okay, so where is the nucleus located? So the nuclei or the nucleus of each cranial nerve. Then the last thing will be the clinical sign. Okay, so the clinical sign of each cranial nerve. And only after the words make sense will we go into the abbreviations, the GSE, the GVA, etc., etc. Let us begin with the simplest question. What are cranial nerves? Cranial nerves are nerves that arise from the brain or the brainstem. So they are like spinal nerves. Spinal nerves arise from the spinal cord, and cranial nerves arise from the brainstem. So we have brainstem, all right? And then we have the cranial nerves arising from the brainstem or the brain. And usually they serve structures around the head and the neck. So they will exit the skull. They exit the skull or the cranium through structures known as foramina or fishes. Okay? Through foramina or fishes. And like I said, they usually serve structures around the head and the neck. So just as you have spinal nerves supplying structures on the rest of the human body, the cranial nerves supply structures around the neck and around the head. So cranial nerves are nerves that arise from the brain or the brainstem, okay? So out of the brainstem comes cranial nerves, and they exit the cranium or the skull through foramina or fishes, and they supply structures around the head and the neck. So just as we have the spinal nerves, we also have cranial nerves. They are sort of the equivalent of spinal nerves in the head and neck region. So in simple terms, cranial nerves are major communication lines between the brain and structures around the head and the neck. There are 12 pairs of cranial nerves, okay? We have 12 pairs of cranial nerves, and we number them 1 to 12, all right? So this numbering system is according to their attachment to the brain. So the first cranial nerve will be the first one that is attached to the brain, and the arrangement is from rostral to caudal. Remember, this is rostral, and then as we go down, we are going towards the caudal region, okay? So that arrangement from rostral to caudal along the brain and the brainstem is how we number them, 1 to 12. That means cranial nerve 1 comes first, and then comes 2, 3, 4, 5, 6, 7, 8, up to 12. Before we go near complicated terminology, we need a rough map, not a perfect detail, just a first pass map of what each nerve actually does. Once you understand how each of them function or what they do, it becomes much easier to organize. You understand, you organize, and then you recall and apply. Don't memorize as isolated random facts. Now, when you look at the cranial nerves, as I said, they are all around the head and neck. And so the numbers are the order in which they come out of the brain. So rostral to caudal. However, when you look on the outside as well, you can see the order in which they are coming from. So cranial nerve 1, technically, although the nose is here, cranial nerve 1, the job is smell. Although the nose is here, the nerve itself lies on top of the eyeballs or in the middle of the orbits. So that's cranial nerve 1. And the receptors or the organ are located in the mucosa of the roof of the nasal cavity. So cranial nerve 1 here, and then you come to the orbits, cranial nerve 2, right? 3, 4, and 6, okay? So the eyeball or the orbit has to do with 2, cranial nerve 2, cranial nerve 3, cranial nerve 4, cranial nerve 6. And cranial nerve 5 and 7, they supply sensation and movement, so to the face. And then we have 8, which is the hearing and balance. And then we have 9, 10, okay? And then we have 11 and 12. Okay, so I'm going to group them that way. And so we've started from 1, 2, 3, 4, 6, all right? And then we have 5, which is the rest of the face. Okay, and then we have 7, which is also to the muscles of the face. 8, okay, hearing and balance. 9 and 10 to the tongue and the throat, the pharynx. They will supply taste and movement of the tongue, 9 and 10, and also to viscera, swallowing. Okay, so they have got to do with this area. And then we have 11, which supplies the sternocleidomastoid and trapezius muscles. Okay, and then we have 12. The 12 supplies the tongue as well. We talked about cranial nerve 1, and we said it is the olfactory nerve, and its job is what? Smell. The sensation of smell. So we have the nose, all right, and then the nerves will move through the cribriform plates, all right, the cribriform plates to form the olfactory bulb. So the nerves from the nasal cavity through the cribriform plate to form the olfactory bulb. And from the olfactory bulb, we'll have the olfactory tract. And the olfactory tract now goes to the part of the brain that is responsible for olfaction. So we have the nose, olfactory bulb, and the olfactory tract. Cranial nerve 2 is the optic nerve. Its job is vision. The pathway starts from the retina of the eyeball. So the fibers will leave the eye as the optic nerve, and some of the fibers will cross at the optic chiasm. And after the crossing, it becomes the optic tract, and it moves towards the visual pathway. So for cranial nerve 2, think vision, retina to brain. So retina, all right, optic nerve, and then optic tract. Remember, before the optic tract, some of the fibers will cross in the optic chiasm, okay? And from there to the visual pathway. So already you can see a pattern. Cranial nerve 1 and 2 are special sensory nerves. 1 is for smell and 2 is for vision. Now we are on the eye movement group. And this is made up of cranial nerve 3, cranial nerve 4, and cranial nerve 6. Okay? So the oculomotor, the trochlear, and the abducens. All right. Oculomotor, which is 3. We have the trochlear, which is 4. And then we have the abducens. Abducens, which is cranial nerve 6. There's a useful pattern, and the pattern is LR6, SO4, okay? SO4 like sulfate. All the rest are supplied by the cranial nerve 3, which is oculomotor. Now let us unpack that. LR6 means lateral rectus is supplied by the cranial nerve 6 abducens. SO4 means the superior oblique is supplied by the 4th cranial nerve, the trochlear nerve. All other nerves are supplied by cranial nerve 3, the oculomotor. Now there are several muscles that move our eyeball. We have the lateral rectus and the medial rectus. Okay, so each eye has a lateral rectus, medial rectus, a superior rectus, an inferior rectus, and then a superior oblique and an inferior oblique. And we are saying that except lateral rectus and superior oblique, cranial nerve 3 supplies most of the extraocular muscles. So cranial nerve 3 supplies most of the extraocular muscles. So most extraocular muscles are supplied by cranial nerve 3. It also raises the eyelid, okay? So it also raises the eyelid through a muscle called the levator palpebrae superioris, okay? Palpebrae superioris. The third function of the cranial nerve 3, so cranial nerve 3, 3 functions. Most muscles of the eyeball, the eyelid, and the third one is parasympathetic supply. 2 intraocular muscles, the muscle that constricts the pupil, and this is important for accommodation. So cranial nerve 3, extraocular muscles, eyelid, and parasympathetic that helps to constrict the pupil during accommodation. Cranial nerve 4, the trochlear nerve, supplies the superior oblique. So cranial nerve 4, which is trochlear, supplies superior oblique muscle. Superior oblique muscle. And cranial nerve 6, which is the abducens, supplies the lateral rectus. If you remember only one thing here, remember LR6, SO4, all others, cranial nerve 3. This pattern saves you a lot of confusion. LR6, SO4, all others, cranial nerve 3. Now let us move to the phase group. I nearly said Facebook group. So phase group. 2 nerves dominate this region. Cranial nerve 5 and 7. Cranial nerve 5 is known as the trigeminal nerve. The trigeminal nerve, and we call it trigeminal because it has 3 divisions. And so we have V1, V2, and V3. V1 is the ophthalmic nerve. Okay? The ophthalmic nerve. V2 is the maxillary nerve. The maxillary nerve. And V3 is the mandibular nerve. And you would realize that the 3 branches of the trigeminal nerve corresponds to different parts of our face. So ophthalmic nerve supplies this area, maxillary will supply this area, and mandibular supplies this area. And the function of the trigeminal nerve is mostly sensation to the face. So general sensation, that means touch, pain, all right, heat, cold, but to the face. Also, muscles of mastication. So for cranial nerve 5, we have sensation to the face and mastication. Mastication is chewing. All right. Cranial nerve 7, on the other hand, is responsible for moving the face. So muscles of facial expression. So facial expression, muscles of facial expression, and taste. Taste fibers, okay, to the anterior 2/3 of the tongue. When it comes to taste, the tongue is divided into posterior 1/3, anterior 2/3. And the anterior 2/3 supplied by the facial nerve. When you think of cranial nerve 5, think of feeling the face and chewing. Cranial nerve 7, moving the face and taste. Later on, we'll also come to realize that the facial nerve also supplies some glands. Okay, but this distinction will later on become relevant clinically. Cranial nerve 8 is the vestibulocochlear nerve. It has 2 major functions, hearing and balance. So it has the cochlear part, which carries sound information to the brain, okay? And then it has the vestibular part, which is responsible for balance and equilibrium information. So when you hear of cranial nerve 8, all right, think of hearing. So when you hear of cranial nerve 8, think of hearing and balance. It's important to remember or to understand that the vestibular apparatus that's responsible for balance is located in the inner ear, exactly where the hearing apparatus can also be found. Okay, these are very tiny structures located in the petrous temporal bone of the skull. Now we come to cranial nerve 9 and 10. And these 2 nerves can feel complicated because they carry various types of fibers. But for now, do not worry about the types of fibers. Just remember the broad jobs or the functions, okay? Cranial nerve 9 is the glossopharyngeal. So you can also get part of the function from the name, glossopharyngeal. And when you think of the cranial nerve 9, think of the posterior 1/3 of the tongue, the pharynx, the parotid gland, the carotid body, and sinus. Okay, so posterior tongue, parotid gland, the pharynx, and the carotid body and sinus. So when you think of cranial nerve 9, the glossopharyngeal, think of the posterior 1/3 of the tongue, the pharynx, the parotid gland, and the carotid body and sinus. Cranial nerve 10 is the vagus nerve, the wandering nerve. It's the only nerve that moves beyond the head and the neck region into the thorax and the abdomen. It is involved mostly in swallowing and voice in the head and neck region. However, it also has parasympathetic supply to organs in the thorax and organs in the abdomen. Cranial nerve 10, the vagus. The word vagus means wandering because it moves beyond the head and the neck region. So for that, think of swallowing, think of voice, and then parasympathetic. Okay, parasympathetic to which areas? The thorax, so organs in the thorax and organs in abdominal region. Okay, that's the function of the vagus nerve. So when you think of vagus, think of swallowing, think of voice, parasympathetic to thoracic structures and abdominal structures. So cranial nerve 9 and 10, okay, the pharynx and larynx group. So when you think of cranial nerve 9, remember tongue, posterior 1/3, the pharynx, pharyngeal muscles, and the parotid gland, at least these three. And cranial nerve 10, the vagus nerve, think of the larynx, which is swallowing and speech, the thorax, and the abdomen. Cranial nerve 11 is the accessory nerve, and cranial nerve 12 is the hypoglossal nerve. The cranial nerve 11 is responsible for supplying the sternocleidomastoid, which is for movement of the neck, and the trapezoid, the muscles here, so for shrugging the shoulder. So when you think of the accessory nerve, which is cranial nerve 11, think of the sternocleidomastoid muscle and the trapezius muscle. Neck movement, shrugging of the shoulder, cranial nerve 11. Cranial nerve 12 is the hypoglossal nerve. That is responsible for the movement of the tongue. Remember, we have mentioned the tongue for two different cranial nerves, but those were taste fibers, okay? Taste fibers, anterior 2/3, posterior 1/3. But now we have a nerve that supplies the muscles that move the tongue, and that is the hypoglossal nerve. Let us pause. We have not started going into the complicated terminology yet. We are first trying to draw a rough map. We talked about 1, which is olfactory for smell, 2, optic for vision, 3, 4, and 6, they are the eye movement group. So oculomotor, trochlear, abducens. And then cranial nerve 5, which is for facial sensation and mastication or chewing. And then we come to cranial nerve 7, facial expression, taste, and glance. Cranial nerve 8, the vestibulocochlear, is for hearing and balance. And cranial nerve 10, posterior part of the tongue, the pharynx, the parotid gland, the carotid body, and the sinus. So next, what we have, the cranial nerve 10, okay, the wandering nerve, remember, and its function, swallowing, okay, voice, and then parasympathetic to thoracic organs and abdominal organs. And then we are going to have the cranial nerve 11, okay, the one we just talked about, neck and tongue. So cranial nerve 11, the sternocleidomastoid muscle, and trapezius, the accessory nerve. So shrugging of shoulders, which is by the trapezius, and the movement of the neck. And finally, the cranial nerve 12 is the hypoglossal nerve. The hypoglossal nerve, and that is tongue movement. Remember that, tongue movement. So that's the summary of all the cranial nerves. Next, we are going to classify them. And that's the fun part. Now let's make it clear, okay? You know the functions already. Now, once you know the functions, you don't have to memorize it. I know there are mnemonics, and by all means use it if it helps you, but understand, like I always say, organize, and then recall for application. So there are nerves that are going to be purely sensory, all right? And which nerves will that be? If you remember, 1, olfactory, okay? 2, 2, which is vision, purely sensory. And then for the third one, we have the 8th cranial nerve, which is the vestibulocochlear. So the purely sensory nerves, cranial nerve 1, cranial nerve 2, because vision, purely sensory. Olfactory, purely sensory. Hearing and balance, purely sensory. Vision, smell, hearing, and balance. And then there are those that are purely motor. So if you remember, we'll start from the eye movement group, okay? So oculomotor, trochlear, abducens. These are purely motor nerves because all they do is to supply extraocular muscles, okay? So motor, we will have cranial nerve 3, the eye movement group, cranial nerve 4, the trochlear, okay? And cranial nerve 6, abducens. Purely motor. There are 2 more purely motor, if you can remember. Do you remember movement of the neck and shrugging of the shoulders? Which nerve is that? Accessory nerve, okay? So cranial nerve 11. And then the last one, tongue movement, hypoglossal nerve, okay? That is the cranial nerve 12. And then we have the nerves that are mixed. Mixed means they contain both sensory and motor fibers. Okay, so facial sensation, mastication. So that's the first one. So cranial nerve 5. So facial sensation and mastication mixed. All right. Which nerve again do you remember that moves muscles and also supplies sensation? So cranial nerve 7, if you remember, facial expression and taste. So cranial nerve 7, cranial nerve 9, if you remember, all right? So cranial nerve 9 also moves muscles of the pharynx and taste to posterior 1/3, if you remember. So that makes it a mixed nerve. The vagus nerve, you know that the vagus nerve, we said it has parasympathetic fibers. It also supplies muscles for swallowing and voice. Okay, and then it has parasympathetic fibers and it carries also fibers of special sensation. If you know this, you already have a better structure than most students who try to memorize the cranial nerve as a flat list. Before we move on, you know I'm a big believer of testing yourself. So let's try this. Which cranial nerves are purely sensory? Cranial nerve 1 and 2, olfactory and vision. And then cranial nerve 8, hearing and balance, purely sensory. Okay, how about mixed? Which cranial nerves are mixed? First one, facial sensation and mastication. So cranial nerve 5. And then facial expression, okay, which is movement of the face and taste. So cranial nerve 7. And then cranial nerve 9 and 10. These are the mixed numbers, okay? So 5, 7, 9, 10. And you are using the functions to figure out the solution. Good. So now we are ready for the part that confuses most students, the language. In the next part, we are going to decode the language behind the functional components.